Obesity is one of the most common problems that I face as a surgeon, so I thought it best to discuss it on this webpage. Pretty much every week I see a painful knee in particular that has early degeneration in it, where the early wear in the knee is associated with being overweight. The knee seems to be the most susceptible joint to what I would call weight damage, that is just wearing out quicker because of the excess weight going through it. I also often encounter the comment from patients in this situation that I can't lose weight because I cannot exercise. Now I have to counter that all the evidence suggests that weight loss has primarily to do with diet, not exercise. Why do I encourage you to lose weight and refuse to operate on some circumstances if you're too heavy? Firstly, the surgery is just technically too difficult sometimes. Secondly, many conditions will resolve if the patient loses weight. Thirdly, the complication rate of surgery is significantly increased if you're obese. So how do I lose weight? Firstly, it's a team effort. I often see a couple together, husband and wife. It's unusual to see one who is overweight and not the other. Now often the husband might not be carrying as much weight as his wife, but a woman's body is different, and men need to understand that. The husband needs to accept that he also needs to lose weight, indeed to take the initiative if he wants his wife to lose weight. So the bottom line is that you do it as a team. If you don't have a wife or husband, then join a group such as Weight Watchers. My recommendations for diet are firstly looking at the CSIRO diet, which is an Australian diet which has good results and is sustainable. This has a 12-week program which is often quite a good idea before surgery. Second recommendation is the 8-week diet by Michael Mosley. This diet involves 800 calories a day for 8 weeks and has excellent results. I'm not a big fan of gastric sleeve or banding surgery, as in my opinion these are just shortcutting the changes which are necessary to lifestyle. So how much weight do I need to lose? I try not to be unreasonable with these things, but if your weight is putting you at increased risk of problems, then equally it would be negligent of me to proceed without changes in this area. So I try and meet you halfway, as it were, and set a reasonable target. My team and I are very happy to help you in this area. We have tried and are trying a few diets ourselves, and my secretaries can often give you better advice than I can.